In the context of the Jiva Vrittis, Swamiji has translated the Jiva Vrittis as whirlpools of the subconscious, unconscious mind. One of the best definitions, when you look at the way he has presented the Vrittis of the Chitta. So the Jiva Vrittis, the whirlpools of the subconscious, unconscious mind, that which drag us down before we know what's happening. Jiva is a term that refers to the individual. For example, we say we are a Jivatma as compared to the universe, which is a Paramatma. So the Atma as the essential spirit that is there, and the Paramatma as the cosmic spirit of the universe, Jivatma as the individual spirit that we all have. The term Atma, of course, is much more a Vedantic perspective. Sankhya has a little bit of it. In fact, I remember some people saying Yoga Sutras doesn't talk of Atma, but it does talk of Atma. So the Atma term is much more Vedantic commonly. We say Paramatma, it's not a term you find Paramatma so much in Yoga and Sankhya. We talk of Purusha and Ishvara in Yoga and Sankhya. But one of the definitions of Yoga is the unity of Jivatma and Paramatma. And that there is an understanding that we as an individual are the cosmos. Just like a drop realizes it is the ocean. So the drop and the ocean are made up of the same essence. You can think of the ocean as the Paramatma, the drop as the Jivatma. And the moment that Jivatma and Paramatma become one, it is called a state of yoga. So yoga as a unification. So Jiva as an individual. So Jiva as individual, Vritti as activities, modulations, patterns. And when you bring these two terms together, Jiva and Vritti together, the equivalent modern term would be biorhythms. So biorhythm, bio is short for biological. So biological rhythms that are part of the individual, and the individual is constantly going through this rhythm. Now what does a rhythm mean? The same thing again and again. So when I say takka dhimi, takka jono, takka dhimi, takka jono, takka dhimi, takka jono, it becomes a rhythm because it's the same pattern repeated again and again. If I do takka dhimi, takita, takka, takita, takka dhimi, it's not a rhythm anymore because it's not the same pattern. So a rhythm means that a certain pattern that gets repeated again and again, basically a loop. So a loop of a pattern becomes a rhythm, and a biological rhythm implies that we as an individual are never stagnating. The only stagnation is death from that point of view. And that is why when somebody is found unconscious, you check a few vitals, you see whether they can breathe, you can see whether the heart is beating. These are very important ones. We say airway, whether there is airway or not, it is very important. You have to look at whether the person is breathing, you have to look at the circulation. So you are constantly trying to understand life as a rhythm. Life as a rhythm. And this is where Jiva Vritti as a diagnostic tool opens us up to understanding the individual and whether their rhythms are harmonious, which means health, or disharmonious, which means disease. Here, a few rhythms can be brought into mind immediately. The rhythm of your breath. So one rhythm is the rhythm of your breath.